Well, welcome everybody to the NLMA 2011 dinner. I'm Lydia Hatcher, and I'm going to be your moderator, if you like, for the evening. I'm going to start with just a couple of comments. As I was getting ready to come here tonight, I was, sort of looking for clothes to wear, and I was standing in the mirror, and I was looking, and my husband was there, and I said, I've got all these wrinkles, and I've got this fat belly thing going on, and I just kind of don't feel like I'm pretty and attractive. And I said to my husband, so why don't you give me a compliment to make me feel better? And he said, well, your eyesight's really good. And that's why he's in a wheelchair. We had an interesting meeting today. And I want to start by saying that I really want to give a vote of thanks and a vote of confidence to our CEO, Rob Ritter, for all the stuff he's put up with. We have had extraordinary times, and our meeting today was quite extraordinary. And another thing I'm going to do that isn't sort of on the formal part of what was happening is we have had a number of members pass away this year, and I'd like to read out their names and then just have a moment of silence. Dr. Ken Saltman from Harbour Grace, Newfoundland. Dr. Ken O'Brien, living in Ottawa. Dr. Anne Perry from St. John's, Dr. Chris Chumweka Ogba from Cornerbrook, Dr. Nora Brown from St. John's, Dr. Jerry Murphy from St. John's, Dr. Howard Strong, Portugal Cove St. Philip's, Dr. Ronan O'Shea, past president of our association, and Dr. David Landells from St. John's. So just a moment of silence in their memory. At this point, I'd like to introduce our guest speaker. That is going to be Dr. John Haggie, CMA President-elect, and I will introduce you, John, in case people don't remember who you are. John was born in Manchester, England, graduated from Victoria University of Manchester School of Medicine in 1977. He completed his graduate studies in general surgery and was certified by the Royal College of Surgeons of England in 1981. Subsequently, John completed a 2-year fellowship at the University Hospital of South Manchester and at the Christie Hospital's Patterson Institute for Cancer Research. This research culminated in his earning a doctorate in 1987. Before coming to Canada, John had held several positions as physician, surgeon, tutor and registrar in the northwest region of England. John came to our province in 1993 as a consulting surgeon for the Grenfell Regional Health Service, which was covered in part by itinerant clinics along the coast of rural Labrador. His work involved, can you hear me now?
Mic's on.
Can you hear me now? His work involved gastrointestinal, vascular and thoracic surgery, as well as urology and orthopedics. In 1977, he moved to Appleton, where he was appointed attending surgeon, general and vascular surgery at the James Peyton Memorial Hospital in Gander. He has held numerous senior staff positions with the hospital. John has been active in medical politics for many years, sharing his expertise and time with the CMA and the NLMA. His involvement began in 1996 when he was elected to the NLMA board at the Grenfell Regional Representative. In 1998, he chaired the NLMA's Communications Committee, and a year later became the NLMA representative on CMA's Political Action Committee. He was elected president of the NLMA in 2002, leading the association during its first ever job action. John continued to serve our association as a member of the Professional Services Liaison Committee from 2003 to 2005. He was also the provincial representative on the CMA's Board of Directors from 2006 to 2009, and served on the CMA's General Council on Health Policy and Economics from 2005 to 2009. Most recently, John served on the CMA's Committee on Education and Professional Development, representing the Atlantic provinces, and chaired the CMA's ad hoc working group on pharmaceutical issues. John still lives in Appleton with his partner Peggy. Between them, they have 5 children, ranging in age from 12 to 25. They have 1 grandson. When time allows, they enjoy pottering at their cabin and RVing or snowmobiling, depending on the season. So I guess the snowmobile right now? So without further ado, Dr. John Haggie.
Thanks, Lydia. Thank you all. It's actually hard to put into words, even for me, just how much of a pleasure and a privilege it is to be here to speak to you today. It's kind of your fault. Someone in here must have voted for me, so thank you again. In actual fact, it's only 8 years ago that I stood before you at an AGM in a slightly different capacity. Then, as a division, we just ended a tumultuous year. We'd had a job action, an arbitration hearing, and then finally a memorandum of agreement. So now it's a different year, but once more, because of hard work, the NLMA has a new MOA, this time with arbitration, well ensconced for the future. Your president, Pat, as well as Rob and Lynn, and the entire NLMA staff really deserve a hearty thanks and congratulations. On the national scene, where you've sent me, we're entering a new era with the election of a majority government. We've had 7 years of successive minority governments, and they provided their own challenges and opportunities. So now we've got some new ones. Last summer in General Council in Niagara Falls, the CMA put forward a vision for the future of healthcare system in a document we called Healthcare Transformation, Change That Works, Care That Lasts. Based on the premise that Medicare in its current form is simply delivering neither quality healthcare nor good value for money, this document was the culmination of 2 years of research, including a study of 5 EU jurisdictions. It lays out a plan for change based on 5 pillars for action, building a culture based around patient-centred care being at the forefront of those. In addition, we have incentives for enhancing access and improving quality of care, for enhancing patient access to care across the whole continuum of patient care, helping providers help patients, and finally, building accountability and responsibility into the system at all levels. But rather than stopping with an internal document, we wanted to take this beyond CMA and our divisions to stimulate a much broader debate. We needed really to hear from the public, to give them an opportunity to articulate what they want the system to look like, and more importantly, what they are willing to finance with their tax dollars. So we spent the last 7 months holding a broad consultation with Canadians to hear from them on the future of the healthcare system as they see it. It's a process that's similar in some respects to the one you're undertaking with the summit on seniors in March and the dialogue afterwards.